I came back in during this discussion of the set-aside, and I very much understand and appreciate that this is a delicate balance, and it is a difficult balance. One can pick 1.0%, 2.0%, 2.5%, 3.5%, 5%, and it is basically a value judgment about the appropriate role of tech transfer and tech development versus fundamental research. There's no getting away from that. But that's the line drawing that this institution engages in on a continual basis. Mr. Glover, I emphatically want to help small business in this endeavor, and it is an effort to help small business that we looked at increasing the set-aside so that although the total amount of funds is going up because of increased research funds, we wanted to grow the pie for everybody so that no one would be left out as we try to get more people in, applicants in, and at the same time increase the size of grants. So I'm very sensitive to your concerns. I just note that there is some significant resistance to changing set-asides, and I think I understand those concerns also. Dr. Rocky, there was, approximately 40% drop in applications to NIH starting in 2004, and that is roughly correlated with the date of the ALJ decision banning venture capital investment, which came down in 2003. Is that correct?
That's correct.
Now, we want to work out something that helps this program remain an innovation as well as a small business program. And it's in that spirit, Mr. Glover, that I'm asking you, to the extent that you know, would you say that a substantial percentage, perhaps even a majority of your paying membership, if you have paying membership, are in the defense industry or funded through DoD, SBIR funds?
They're not. Our current chairman basically has a significant number of NIH awards, and is one of the top NIH award companies. Many of the other companies are as well. Well, we're across the whole spectrum.
Well, Mr. Glover, in looking at some of the data, it seems to me that the organizations that you have brought in, when I've dug underneath, every single one of them was on the DoD SBIR.
Mr. Chairman, very few. We've only had one witness appear before this committee from the Small Business Technology Council.
Oh, I mean folks who came to my office.
Oh, I'm not sure who all have come to your office, but there's certainly half of the program is DoD, and many companies that are in other areas are also in DoD.
Well, Glover, I'm asking this as a friendly question.
I understand,
and I'm trying to find some basis which hopefully gets us away from capital structure as a proxy for either domestic ownership or as a proxy for the character of a small business, because I think 500 employees is quite crisp on that front. It seems to me that a lot of Mr. Greenwood's issues have to do with biotechnology, and they're also software and hardware companies that burn a lot of cash. But if it is the case that DoD uses SBIR in a fundamentally different way as an adjunct to its research, as a spur to innovation by the large defense contractors, then perhaps what we can do, if we can't get away with an intellectually pure solution of getting away from capital structure as a proxy for size, at least taking a substantive approach of perhaps exempting DoD from the new statute. And that is the avenue that I'm trying to explore with you as an alternative, which may be even more palatable to your membership than the generous concessions which we made in negotiation in the last Congress to take into consideration the very real concerns that your membership has.
It certainly solves the problem for approximately half of our members. of those members who are in the health sciences and the biotech, there are a lot of very good, important small biotech companies who are working very hard to survive. The only source of funding.
Those small biotech companies not have venture capital investment.
Absolutely. Many of them do not have venture capital, and they are successful.
Would you characterize those companies currently?
Well, some are here today. The state of Maryland has a wonderful program for angel investors that's making some of our biotech companies in Maryland grow very nicely. You got a 50% tax credit for investing in those companies. They've gone to that source. They've been able to raise angel capital and move their companies. There are many successful biotech companies that don't get angel capital.
Earlier, Mr. Glover, you said that the HHS SBIR budget would be insufficient to commercialize one pharmaceutical. Are you saying now that these small biotechs can make it on angel investment alone?
Many have so far.
Then are you
but I'm talking. Now, when you talk about,
are you going to take back what you said about HHS and its SBIR program?
No, sir. There's a very clear distinction. Mr. Greenwood has said many times that it takes $800 million to take one drug through the FDA approval process. There are an awful lot of technologies that don't have to go through that $800 million process. But those that have to go through that process, you couldn't use the whole HHS budget to take one drug through that process.
Mr. Greenwood, I'm going to give you an opportunity to respond to this conversation.
Yeah. Mr. Chairman, I do want to respond to one thing you said earlier. I was very careful about believing the information and data that I provided. I did footnote virtually everything I said so that you can, at a time, take a chance to look at that. We're very careful about that.
I read your submissions to the subcommittee with great interest and in detail.